Safe to do filler beside chin implant? Will the chin skin become saggy or loose? The bottom edge of my chin implant shows when I tip my chin down, making it appear as though I have a double chin. Also, the edge shows in photos taken at a lower angle. My plastic surgeon suggested filling in the area where the implant rests against my chin bone with Juvederm. My concerns are, will this look natural? When the filler is fully gone, what will my skin look like? Thank you in advance.
Thank you for your question. You submitted your question with a single photo, and you have a concern about the way your chin appears when you move in a certain position and after undergoing a chin implant, where the edge you feel is more visible in certain positions and that you appear to have a double chin. And your plastic surgeon suggested placing Juvederm in this general area, and you're concerned about what happens when the filler disappears and the relative indications and safety of using fillers around a chin implant. Well, I can certainly share with you how I counsel patients who have chin implants and have a desire to improve certain areas around the chin implant and what the relative risk is. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Facial implants is something I have done a lot in my career, and surgical placement of chin implants is fairly common. In addition, we also do a non-surgical procedure that creates the impression like having a chin implant. We call it structural volumizing, and we use injectable fillers such as Juvederm, and in the Juvederm family, Juvederm Ultra Plus and Juvederm Voluma. So the question then comes up, what to do when you already have a chin implant? Well, it's certainly a valid question, more from the perspective of a potential risk of infection as well as the relative safety in this area. That being said, I think that if your plastic surgeon is the one who placed the chin implant and is doing your injectable filler, your surgeon should have a certain sense of what to do to maximize sterility. But I would just caution that that's one area that it's important. So when we do structural volumizing in our practice, we actually do it like we do surgery. We do things with extensive sterility and proper technique. And as far as the rest of your concerns about the appearance of the skin, of whether it would stretch or sag after the filler is gone, I don't think you have much to be concerned about. When it comes to basically adding volume to create improvement in transitions in area, your skin is really not being stretched very much. If anything, what's only being done is to fill relative indentations and hollow. So for example, if we were trying to add volume in the cheek area for someone with facial hollow, well, that's restoring volume in an area which has lost volume. Therefore, the skin is not really stretching, it's just being filled up to a limited amount. So the same thing applies for this area under the chin. And even when we do something more aggressive to try to, quote, mimic the appearance of a chin implant, the skin will only tolerate so much expansion before it literally pushes back in the other direction. So I think that you can be confident that the skin won't stretch too much. I think this is more about putting the right filler in the right amount, in the right places to get the best appearance. As long as you and your doctor have a good dialogue about what the outcome will be, and you're able to see what your results will be before and after the injectable filler is placed, I think that it's certainly well worth moving forward as long as you and your doctor have a certain strategy and plan well communicated. So I hope that was helpful. I wish you the best of luck. Thank you for your question.